Vaccines, the shot that will save your life. In this speech, I will discuss the importance of vaccines and why we as a society should get them as a whole. We will discuss the importance of vaccines, the myths that surround vaccines, and how do vaccines keep us healthy. Why is it important to get vaccinated? Vaccines protect yourself and others from contracting potentially dangerous to deadly diseases. The National Foundation for Infectious Disease states that vaccines are one of the most safest medical treatments you can receive. For instance, let's look at the varicella vaccine, otherwise known as the chickenpox vaccine. According to the Alliance for Aging Research, it is estimated that the vaccine reduces occurrence of shingles by 51%, reduces death rate by 33%, and saves over $103 million yearly in healthcare costs. Now hearing this, let's discuss some of the myths that are associated with vaccinations. It is believed that once you receive a vaccine, you are automatically immune to the disease. This is false. According to the Cleveland Clinic, it is estimated that vaccines are 90 to 100% effective at preventing diseases from entering the body. Are vaccines deadly? According to the World Health Organization, vaccines are very safe and you have more chance to be fatally injured by a deadly disease than by a vaccine. Perhaps one of the biggest myths associated with vaccinations is that the influenza vaccine or flu shot is a nuisance and does not need to be given to people. This is a lie. The World Health Organization estimates that over 500,000 people die yearly from the flu. Most of these people that are commonly affected by the flu shot are young children and the elderly. Another popular myth is you do not receive a vaccine for a disease that is no longer around. This is completely false. People getting vaccines prevent diseases. A popular demonstration of this was the measles outbreak in Disney World. According to the Center for Disease Control, it is believed that the problem stemmed from areas where the population at Disney World had a vaccination rate of 50% or lower, allowing the disease to spread. Nobody wants measles when they go see Mickey Mouse. Lastly, how do vaccines keep us healthy? How do vaccines work? There are many types of vaccinations. Some examples of these are inactive, meaning the virus is dead when entering the body. Attenuated viruses, meaning the virus has been grown in a lab, allowing for the virus to become weaker, which means the body will be able to defend itself more aggressively, allowing for a faster antibody defense. This being said, this is a live virus, and it allows you to have a common reaction to the virus. Some popular vaccines of this are the influenza virus, otherwise known as the flu vaccine. According to the Indiana Public Media, vaccines keep us healthy by acting as barriers to the outside world. When we receive vaccines as children or adults, we allow our bodies to form antibodies or defense mechanisms to the vaccines we receive. This allows our bodies to develop strains or antibodies to counteract and defend ourselves when coming in contact with these antibodies. For instance, the yearly flu vaccine is developed out of Center for Disease Control, where they implement flu vaccinations for what they believe would be the flu strain that will affect us yearly. It is their hope that when they launch the flu vaccines, they will pinpoint the strain that will affect most of the United States, allowing the flu vaccine to do what it is supposed to do and protect you from that year's flu. In conclusion, I hope that I have shown that vaccines protect us and our bystanders from harmful diseases by acting as a natural defense to harmful diseases that surround us daily. Perhaps one of the biggest stories about vaccinations was the recent Ebola outbreak. There have been major medical advances in the Ebola vaccination since the outbreak has become more prevalent and has struck the world by storm. Most of the people who have come home with the Ebola virus have not been vaccinated and also have refused to get vaccinations to this common disease. If they would have received the Ebola vaccination, this problem could have been prevented and would have saved many lives and would have prevented many infectious disease spreads. I hope that you have learned a lot from this vaccination presentation and hope that you consider next time that when you get vaccinations, you would make the right choice.